Great. Thank you, Dr. Nima, for setting up such a wonderful webinar. And it has been really a great pleasure and privilege to work with Professor Kim and Professor, Baru and other colleagues from India and mainland China. So today I'm mainly I joined to share the story of Hong Kong. Hopefully, we can generate some sort of takeaway points from the trajectory of continuity of care in the Hong Kong Special Administrative Region. So first of all, Hong Kong, why Hong Kong? Why is Hong Kong included into this comparative study? Hong Kong, first of all, is a part of China and is a special administrative region enjoying high level of autonomy. And this is one of the Asian tigers and so on. So, and then the other side of Hong Kong is the graying trend of the demography. So one of the super aging societies, if you look at the life expectancy at birth, Hong Kong is probably highest together with Japan and South Korea. And then, according to government projection, those aged above 65 years old will go up to almost one third, more than one third actually, just in a few years' time. And then with this changing demography, we see rising multimorbidities. And in the meantime, what set Hong Kong a little bit different from other societies is a is a tragedy. It's a very high level of elderly poverty rate in such a high income society because close to half of the elderly population live below the poverty line, largely because of the lack of universal retirement, retirement protection, which is pension. And then there's no social insurance whatsoever in this highly liberal and capitalist city. So such a problematic financing regime partially impedes ability to pay for the vast population in the elderly population. And then, of course, family support system has been weakening. You cannot count on your adult children for providing those care. And then, if you look at the healthcare and social care, the division and public-private mix, we also see high level of fragmentation in Hong Kong as you often see elsewhere. So let's look at healthcare first. So we often use the concept of dual track medical economy to describe the nature of Hong Kong's healthcare system. You do see public and private each contributing approximately half to the total expenditures on health. The public system largely resembles the British NHS because Hong Kong was a British colony before, and then the government provides 90% of the public hospital recurrent expenditures. So the public hospitals largely, are largely financed by the government, and then it provides 90% of the inpatient care services. And then there is actually a sizable private system, but it's subject to very little government regulation. And then the coordination between the public hospital system and the private hospital system tends to be weak as well. And then 70% of outpatient care is provided by the private system. But then luckily, in the recent years, there has been quite big progress in terms of, informational interconnectivity. So the ICT technologies have been quite widely used to connect public and private system. So sharing data, sharing medical records has been possible in Hong Kong. But in the meantime, you do see what we often see in NHS, right? Extremely long waiting time in the public system, particularly in specialist care. That has become a major problem that most Hong Kong people are concerned with in the healthcare system. And the long-term care system in Hong Kong, look, there are some sort of, terminological issues here. Social care in Hong Kong includes actually quite a few types of care. But because most of those care recipients are the elderly suffering from chronic disability, therefore, social care in Hong Kong technically refers to long-term care. So it includes residential care, community care and support, and transitional care, the care transition between different settings, particularly from hospital setting back to the community, so discharge. So the level of institutionalization in Hong Kong is relatively high. So when the elderly patients, suffer from chronic disability, and then the default option, default choice is to move into the government-funded NGO, which provides professional services, professional residential services at a very, very generously subsidized rate. But again, you see the mirror of the NHS, and then because the long queues have also been a major problem, major hurdle to accessibility. And then in the meantime, you also see, the mirror of the healthcare system in social care. because the private residential care services are widely available, but they're highly expensive and the quality also varies dramatically. In the past few years, we have seen, scandals like, like abuse sometimes, sub-quality in the private sector being, exposed, in the mass media reported. So that also drew widespread public concerns on the quality and necessary regulation. And then in order to reduce the waiting time, in order to relieve the burden, the government also, initiated a few other initiatives. For example, they purchase private beds from with government finance, and then the eligible elderly can move into the private nursing homes, but still pay the government subsidized rate. This is a very very typical Hong Kong way of doing things. Hong Kong style PPP, public-private modality, usually operates in such a way, government purchasing services. And Hong Kong is different from South Korea, from Japan, where pretty established long-term care insurance, systems are available. And in Hong Kong, there's no long-term care insurance whatsoever. There are some minor, commercial insurance products, but they are just very, very minor. Therefore, all these factors combined essentially mean that, there's huge unmet demand in the social care, sector in Hong Kong. And then this is a kind of the highlight I want to really draw here today. Needs assessment. Needs assessment is very essential. It's essentially kind of gatekeeping mechanisms, right, in the social care system. And in this aspect, Hong Kong's practice has been pretty laudable. So there has been a standardized need assessment mechanism, which is very very comprehensive. So the elderly patients and their family members can raise a request, and then there will be initial screening, and then the assessor will conduct assessment and then explain the result. And before you are qualified to move into government-funded, nursing homes, which provide good quality residential services. Because this project does not only look at public-private mix, we also pay considerable attention to, care integration. How do we integrate various types of care to improve the well-being of the elderly patients? So maybe this slide is of some reference value for the international audience, because there are quite a few, mature, elderly care integration models in Hong Kong. For example, the integrated home care services, they offers enhanced support, care, and rehabilitative services to community elderly. And then you also have this transitional care services, which is called enhanced home and community care services. They create a platform to provide, integrated services for the frail elderly, particularly those discharged from hospital setting. You have the integrated care and discharge support and the community geriatric assessment teams. So all these, care models share one major mission, that is to reduce unnecessary hospital readmission. So this slide is something very, very new. This is another major flagship program in Hong Kong in the past few years. And so the district health centers, everybody knows the importance of primary care. We should strengthen it. And how do we exactly strengthen primary care? And this is the new practice in Hong Kong. So they set up, so-called district healthcare center in every administrative district in Hong Kong. And then they work to strengthen the gatekeeping and better connecting family doctor, and with specialist care, and so on. Of course, this is still too early to assess the success, the outcome of this model, but for your reference only. So this is the last slide. Let me summarize, the Hong Kong situation. I am a policy scientist. I study public policy. So people like me are more sensitive with governance, with the dimension of governance, because healthcare, in our view, in our disciplinary, lens, is not medicine per se. It's everything is ultimately governance. And we see major fragmentation in healthcare and social care in Hong Kong. And in my view, this is deeply rooted in the fragmentation of governance. As oftentimes you see in other countries and other regions, you see, the health bureau, the health ministry is taking care of health, and then, however, long-term care oftentimes belongs to another ministry's portfolio. So if you have this turf war and you've had this bureaucratic fragmentation, care integration will become very, very difficult. So, South Korea has integrated the Ministry of Health and the Ministry of Social Welfare. Hong Kong has not done so, and therefore we see that there's pretty strong demand for horizontal integration. Maybe a kind of ministerial restructuring will provide more conducive conditions for better integration between the health sector and the social care sector. And then we also see that, overall from my introduction, I hope you get the view that the public-private mix in Hong Kong is very, very skewed towards the public system. And the public system in both health and social care is overburdened. What the Hong Kong government has done is primarily to make extensive use of supply side, demand side interventions, particularly called vouchers. And we also see public-private partnership being widely used. And behind public-private partnership is actually the actual practice is government purchasing private services. And Hong Kong has also made some good progress in ICT tools. So the ICT tools turn out to be pretty useful to connect public and private providers. But of course, we always have to be aware of this great digital divide. How that is going to be overcome needs to be seen. And lastly is manpower. And very, very similar to the situation in Japan, in South Korea, and manpower shortage has also been a major hurdle for Hong Kong's social care system. So I'll stop here and look forward to Q&A. Thank you.